Welcome back. Even as a federal judge temporarily pauses President Trump's order to freeze federal funding assistance, the State Department's already taken sweeping measures to halt foreign aid. The directive says that the State Department and U.S. Agency for International Development, USAID, must stop all spending while the new administration carries out a review. The notable exceptions were emergency food programs as well as aid for Egypt and Israel. Jeremy Kanainik, who is the president of Refugees International, is here now. He formerly served as an official at USAID, which I know, by the way, has taken quite a hit in the last few days as we hear that current officials are being escorted out of the building or reassigned or taking down any visual demonstration of the work that's been done. It's a really distressing time for a lot of people in this space.
It's an incredibly distressing time. It's a frightening time. And many organizations are very fearful to speak out and talk about what's going on. I'm able to do so because our organization, Refugees International, does not take federal funding. Otherwise, we would be in a similar spot.
So what he just said was, it's something that I said yesterday in the last video about DeepSeek, that self-sufficient, that his NGO company actually doesn't receive funding from America, receive funding internationally. And he's able to speak freely and openly about the circumstances around cutting foreign aid and programs like PEPFAR, which is the subject of this video. So let's continue to listen to him, and I'll come back and give you more of my thoughts about this section. Okay.
Which global U.S. programs are you most concerned about being disrupted at this point?
So a few things that I would point to are the programs that right now in real time are ways that America is saving lives around the world, and that is our global health programs and our humanitarian programs. So every day at U.S.-funded HIV clinics around the world, more than 200,000 people go and they pick up their antiretrovirals to keep their HIV infections suppressed. That has stopped. People are turning up to those clinics. They cannot get their drugs. Humanitarian programs are pulling out of refugee camps, pulling out of the famine zones in Sudan. That will very quickly begin to kill people.
I mean, it's within a president's right to review everything. But when you hear that real world effect, that there are people showing up looking for the help that's been there and realizing it's not, you got to wonder what kind of an effect that has. And you've been quoted calling this action to limit foreign aid a, quote, win for China. Why is it a win for China?
So foreign aid is one of the principal ways that America shows up in the world and that we show American values to the world. And so when we are providing HIV drugs, when we are saving lives in refugee crises, we are showing up in the world in a way that shows an American spirit of generosity. This shows the opposite. And it also, in addition to just making us look cruel and callous, it makes us look deeply unreliable.
So yeah, that's the situation. So what's this funding is all about? We're going to listen to the Minister of Health from South Africa, because South Africa, they do run a really good HIV/AIDS program and in the world, and he's going to tell us some breakdown what the funding models like, where America's funding helps. Mainly it helps with the staff and follow-up and testing. And let's listen to him.
We've got an army of 271,000 people, 606 on the ground in the 27 districts fighting HIV and AIDS. 256,452 are funded by us as South Africa from our own fiscus. That leaves us with 15,145 people. Those are the ones who will be affected by whatever withdrawal is there. Now, how is the funding conducted? 76% of the funding is from South Africa. 76% of the funding. 74% by the government, fiscus, and 2% by the private sector. That includes medical aid. All the medical aids in the country are contributing 2% to the fight against HIV/AIDS. Otherwise, the rest is government. Now, obviously, as you can see, that leaves us with a gap. And that gap is filled by Global Fund, which gives 7%, and PEPFAR, which gives 17%. So when you add Global Fund and the government of South Africa, or the South African either governmental private sector. When you add them, you realize that is 83%. So PEPFAR remain with the 17%. That's where our problems are. Now, we are buying ARVs on our own with 10% from Global Fund, which is not affected by this. I'm sure you are aware. Global Fund is an international organization in Geneva. We are buying on our own. So our biggest problem will be the salaries and the operational costs of those people that I've just mentioned. That's what we are trying to look at with Treasury. We're supposed to have a meeting yesterday, which could not happen because they were preparing for this Lekgotla, as you understand.
Yes, so it's interesting. So they don't actually fund HIV/AIDS medicine. South African government buys this medicine. The only funding is used for staff who are responsible for follow-up, those staff that works for this NGO. They in South Africa, they're funded by America to provide follow-up for people who are receiving medicine for HIV/AIDS in South Africa. The rest of the funding is provided by the government and private sector, and other 10% from the Wealth Fund that he's talking about. So, however, there's still a shortfall. They still have to look at how they can meet that shortfall. Like I said in the last video, these things they should now know how they can do this, because you don't actually, I feel like things like charity are only for emergency. People, when you have bushfire and you have things, that's for emergency. After that, you need sustainability. What is the plan for sustainability of healthcare in general, for medicine? We saw that during COVID, how Africa got the vaccine when people in the West rejected the vaccine, when there was leftover vaccine. And at that time, the Ramaphosa was talking about, developing capacity around manufacturing and providing industry. Talk is cheap, but where is the government that is going to, of innovation, that's going to look into these programs? Because you can't rely on these international bodies and funding. You should develop capacity around manufacturing these medicines. There's a lot of skills that are out there internationally that people can come in and help these governments in collaboration with, of course, with World Health Organization to come about, research that can actually have a lasting peace and lasting access to these medicines that are needed for health, for well-being of this community. I am so stunned. Actually, not surprised. Actually, not stunned, but I'm not surprised, because I thought about it and I thought, yeah, the South African government, hopefully they haven't got any contingency plan for this. They haven't actually thought about how they would actually mitigate against this sanction, against these threats from Donald Trump, how they're gonna work around these threats, because they are there. The very fact that Donald Trump is there, these threats are there. So as a government, they should be sitting around now knowing if these sanctions they happen, this is what we're going to do. This is how we're going to mitigate against it. It's only China and Russia is able to actually come up with strategy to mitigate against any sanction by America. It's only those two countries that have been able to, come up and triumphant after every effort to try and sanction them. So developing resilience and sufficient resources is important for security of that country. Every country needs to cannot just rely on import and exports, on importing stuff, that other country can start saying, no, I'm not going to send them these medicines. I'm going to keep them. The next thing you can start to say, I'm not going to send this medicine to them. So what are you going to do if he says they're not even ban any export of medicine? What are you going to do about it? You can't do anything about it. So what you need to do as government, the governments, they need to do is to build capacity around manufacturing these medicines. Many of these medicines are off patent anyway. You can make generic brand of those obviously the new ones, like that are, injections and all of them, they're new, they're still patented medicine, but the other old ones are available to be made as generic. So generic medicines are equivalent to the originator brand. They just have to prove that the same efficacy and safety standard as the originator brand. They are the same thing. So, and any company with accreditation of good manufacturing practice, they can actually produce this medicine and provide medicines for all these disease like HIV, AIDS, malaria, and TB, and all of those educational programs that NGO are responsible for around this community. Many of these community that wouldn't even have any access to healthcare, that they will be lost to follow up. Having staff and on the ground to follow up that are very familiar with the community. It's very important when you're dealing with healthcare, and you need that staff funding for that. And that's where the shortfall is with this American, Donald Trump stopping the funding for the NGOs, any programs internationally about it. But, let's gonna listen to the former president of Kenya talking about this very thing. I think he echoed the same sentiment as my sentiment about this issue, but he says it in a way that politicians says it. I wouldn't say it that way, but the sentiment is the same.
People the other day crying, oh, I don't know, Trump has removed money. He said he's not giving us any more money. Watu wanalia. Why are you crying? It's not your government, it's not your country. He has no reason to give you anything. I mean, you don't pay taxes in America. He is appealing to his people. Shauri yenu bana. This is a wake-up call for you to say, okay, what are we going to do to help ourselves? Instead of crying, tujiulize, what are we going to do? Haya, ametoa hiyo pesa, sasa tutafanya namna gani jameni? What are we going to do? Yeah? To support ourselves. Because nobody is going to continue holding out a hand there to give you. It is time for us to use our resources for the right things. We are the ones who are using them for the wrong things.
Yeah. Why are you crying? It's not your money. You don't pay tax in America. You should cry for your government. Government is responsible to look after its citizens. Ramaphosa must go and find that money under his mattress. That shortfall, they should go and find it. It's somewhere. I mean, engage in this big government with so many ministers who don't do anything. There's a lot of money there to be made, to be found. Okay? The sentiment is the same. You've got to find the money to look after your own citizens. If you're in government, it's your responsibility. It's not America. No, it's not America. It's not responsible for you. You're responsible for your own citizens. Yep, that is true, but that needs capacity. I don't even understand why these people still think they have a relationship with America. Why do you think you still have a relationship with America? And especially for South Africans, why do you think you need to have a relationship with America? You don't have a relationship with America. That relationship is gone, finished, buried. You're crying over the milk that's on the floor. It's on the floor, you can cry, it's gone. It's time to move on and create a relationship and partnership to other like-minded people and countries. You can't live in fear Like you're living around and thinking, oh, I wonder who's going to be the next president of America. How are they going to do? How are they going to treat us? I mean, you're not the voter for America, but you're so anxious about America. We don't vote for them. The Americans vote for their president. Anything they do shouldn't affect us. You need to build capacity that anything that they do, they have little impact on citizens, your citizens. You know, it's capacity building around having resources that are needed to maintain services and provide healthcare for needed communities. So yeah, comment below what you think, and if you think you know, the sentiment around building capacity and resources and people following the China's you know, footprint of building capacity, finding talent within your community, within the nation, and funding it so that you build capacity and be able to provide, you know, those objectives, to meet those objectives. So China's objective was to advance the AI. They've done that. They've surpassed it. You know, they collapsed the whole tech industry. I mean, it's on a nosedive right now as we speak. Nearly $1 trillion lost for NVIDIA as a result of that DeepSeek. So even in other industry, they can do it. Partnership. Can't do it by yourself. You need partnership. Anywhere we go, with a career, relationship, it's all about partnership. Business, it's partnership. Partnership needs to work for both sides. Can't have a bully. If one person bullies the other person, that's not a partnership. Thank you guys for listening. Comment below. Until next time, see ya. Bye.